Okay, in this video I'm going to be doing the assessment on skin, hair, and nails. And while you're doing your assessment, the best time to do your patient teaching is during the assessment. Talk about what you're seeing and what you're doing. First thing you're going to do, you're going to have adequate lighting so that you can see what's going on with the patient's skin, hair, and nails. You're going to look for symmetry on both sides of the body. You're going to check the textures, the general pigmentation. You're going to note like the differences with the suntans. That's fine. Just make sure that you're using sunscreens whenever you're outside with sun exposures. And notice any differences in pigmentations or lesions or color changes from the differences in the size. The textures will vary from the thinnest skin to the thickest skin being on the eyelids, thickest skin being on the soles of the feet and the palms of the hands. You're going to check the temperatures of the skin, backs of the hands, fronts, palms of the hands, feel for temperature differences. You're going to check, while you're doing that, for moistures. The skin should be oil-free, not moist. These could be signs of other potential problems, disorders. And you're also, while you're doing that, you'll check for edema, pitting edema, swelling on various parts of the body. You're going to check for the mobility of the skin. You're going to move, like on the head, the scalp should move freely. And check for the turgor. Check the turgor by pinching the chest or the backs of the hands. It should be elastic and bounce back into place. The skin should be blanchable. When you push on it, it blanches. You're going to check for hygiene in skin folds. You're going to check, lift their arms up, check underneath the difficult to reach areas for the hygiene. Notice any odors, any rashes, irritants in those areas, and do teaching related to that. You're going to check for bruising, any vascular changes, which would include in the lower extremities, loss of hair in the lower parts of the legs, the feet, the toes, could mean vascular issues. With the hair, you're going to notice the textures, the disbursement. Male pattern baldness is normal for men, and some people do choose to shave their heads. His hair is a little bit grown out, due for a trim, but you're going to notice the colors, the textures, and the dispersion, distribution of it, and you're also going to look for any scalp lesions by feeling all over. You're going to also inspect the nails on the hands and the feet. You take a ruler and place it across the finger. You're going to check for clubbing, which would indicate cardiopulmonary issues. So 160 degrees is what you're looking for, which is, these are good. Clubbing would be 180 degrees or more. That's something that you do not want. Then you're going to do the capillary refills, mash less than 3 seconds for them to refill, and do it on the feet and the hands, and squeeze on the fingers, just looking for any lesions or any problems, consistencies, shapes and contours, and just do this routinely every week, and notice any changes in any particular moles or places that he's not really got any places on him, but you want to check the colors of them. The ABCD rule of melanomas: look for asymmetries. You're going to check for the borders, the color variations, and the diameters needs to be less than 6 centimeters, and which is about the size of a pencil eraser. And just keep an eye on it. It should be smooth around the edges. And I think that that's pretty much it. Any questions?